Hello, this is Dr. Gay from First Look MRI, and this is a good case of pattern recognition. Sometimes you can just glance at one slice and know what is going on, and this is one of those cases where they have a constellation of findings that's pretty typical. So this is a 16-year-old male who plays football. He injured his knee recently, has knee swelling and pain, and this is just a midline cut. This is called a T2 weighted image on the left. This is a proton density fat suppressed image on the right. Same orientation here where we see the kneecap towards the front. We see the femur here and the tibia here. Now in the T2 weighted image, the marrow is bright in the femur and pretty bright in the tibia. On this view, it's more sensitive because marrow is fat suppressed and it should be dark like this, but there's a big area of brightness in the tibia. So a really prominent impaction injury here, bone injury of the anterior tibia. Also, we note on this view the brightness here. This is fluid and Hoffa's fat pad. Normally there's a dark uniform collection of fat here called Hoffa's fat pad, but instead it's bright, kind of stellate bright signal through here, confluent edema or hemorrhage right here. So we know that there's been a very significant injury of the tibia, a high-grade impaction injury, a prominent bone contusion, and also crush injury of the Hoffa's fat pad. And when we see this injury, we look for, let's see, the ACL. It looks normal on this midline cut. It comes from the back of the femur to the front of the tibia, so that's great. But we also look back here for this. This is called the posterior cruciate ligament, the PCL. It goes in the opposite direction here. And this is not straight and taut. It's lax and curved. If we go on a couple different slices here, it never connects to the femur. So this is a torn PCL. It's lax and it's torn from the femoral attachment. And also, if we go back on one slice here, we see the posterior joint capsule behind the knee is lax and it's not even visualized in this area. So this happens when the people tear their PCL. They also get to tear the posterior joint capsule very commonly. And these two things together, the bone bruise in front and the edema here in front, means this is impacted somewhere up here in front, usually the femur, and then it's stretched back here. When the tibia swings forward, the PCL will try to keep it from going forward. It's attached here and it limits the anterior extension of the knee. That's why the tibia can't swing forward, because of the PCL. But in this case it is ruptured, and the posterior joint capsule is ruptured as this tibia swung forward and impacted right here. So this is a case of a hyperextension injury with a high-grade impaction injury of the tibia, associated injury of Hoffa's fat pad, and these associated distractive force injuries of a ruptured PCL and posterior joint capsule tear. So a very common pattern, just glance up, hey, bone contusion here and edema, and injury back here. You might have had a hyperextension injury. Thank you very much.